My name is James Bonaffinii, and I'm a senior scientist at Rancho Biosciences. As a senior scientist, I work with a variety of pharmaceutical clients to integrate, curate, and process their clinical data to determine the safety and efficacy of drugs that are currently undergoing clinical trials. Well, I've always been a bit of a tinkerer. I like taking things apart, putting them back together ever since I was young. And I suppose when I entered high school, I also kind of got an itch for more physiological or biology-related courses. And I thought a good way to marry those two interests was to go towards biomedical engineering. And when I attended the various open houses at UVA, in specifically the biomedical engineering department, it really got me interested and made me want to pursue that field. I love being able to help the really hardcore clinical data scientists with the work that they do. These are people that have been in the field for decades and they're very, very good at their job. But a lot of times they need help with streamlining their processes, and I'm glad I'm able to help them do that. So they are able to tackle a bunch of different data from a lot of different studies and really speed up their process. And it's really cool being able to see some articles that come out from the various clients that I work with saying that a drug has progressed to the next phase or has been approved by the FDA. It's very inspiring. Yeah, so as a master's student at UVA in the Master of Engineering program, I was working on a capstone project where I helped peritoneal dialysis patients in lowering the incidence of infection. And it was really interesting being able to see the entire patient journey as they progressed from diagnosis to eventually having to undergo dialysis, and seeing that entire journey, seeing where there might be inefficiencies in that journey and how to aid people to live their lives effectively despite a chronic disease it was a great experience. This is a hard question because it's difficult to talk about times when you perhaps made mistakes or wish you could have done more. But as an undergrad, I had a very difficult time finding a job in the biomedical engineering field. And so I ended up going and getting a job in a parallel engineering field. And I think what I learned was that I had to make the most out of every opportunity. And I learned a lot through the 3 years that I was working there and determined that I would like to go back more towards biomedical engineering. And I believe that those several years of working in that industry prepared me even better to come back and make the most out of my master's program and the career after that. The first thing I would say is advocate for yourself. If there's something that really interests you, you should definitely explore that topic. I think some people are scared to try new things, and I totally get that because a lot of things are very foreign, and it can be intimidating to approach different people or approach faculty members. But I think they're always here to help, and if you express an interest, then they will reciprocate. And the other thing I would say is make sure you have a strong network. Attend every event that you can, especially with the CVIL BioHub or other biotech-related events, because building that network, you can lean on those people. You can learn more, see where you could work on, and then perhaps explore your career in that direction.